was a Tuesday morning in the lab, just like any other. Racks of blood tubes were lined up, waiting to be processed. I was walking through, checking on the day's workflow, when a lab technician called me over. She held up a vial of blood. It looked nothing like the deep red I knew. It was opaque, thick, almost pinkish white. It seriously looked like a strawberry milkshake. This wasn't just slightly cloudy blood. This was grossly lipemic, a sample so full of fat it changes appearance. It's a striking sight that tells you something significant is happening inside the patient. Seeing a sample like this sets off alarm bells. It's a visual cue that a patient's metabolism is under extreme stress. That change isn't a curiosity, it's a critical diagnostic clue. Normal blood plasma should be clear, straw-colored after spinning, but this sample was different. The plasma layer was thick, creamy white, sitting on the red cells like cream. The culprit is an extremely high concentration of lipids, specifically triglycerides. They travel in the blood in little packages called chylomicrons. When chylomicrons skyrocket, they scatter light and the plasma turns thick, opaque white. Common cause, non-fasting. Example, a fatty meal, burger and fries. That's why doctors ask you to fast 8-12 hours before lipid tests. But strawberry milkshake samples are usually beyond a single meal. Major cause, uncontrolled diabetes. Insulin normally helps clear fats and sugars. With insulin resistance or a lack of insulin, triglycerides can't be cleared and build up. Genetic cause, familial hyperlipidemias, too much production or poor removal. These are inherited and can show up young. When we see a lipemic sample, the first thing we do is run a lipid profile. The results from a grossly lipemic sample are often shocking. Normal fasting triglycerides, under 150 mg/dl. Milky plasma cases, triglycerides well over 1,000 mg/dl, sometimes soaring past 5,000 mg/dl. These numbers are critically high, a major metabolic breakdown. The lipid profile also looks at cholesterol. Severe hypertriglyceridemia often raises total cholesterol too. That's because particles carrying triglycerides like chylomicrons and VLDL also contain cholesterol. Measuring LDL and HDL becomes challenging with lipemic samples. The Milky lipemia interferes with lab machines' direct measurements. What does a person with such high triglycerides actually feel or look like? In many cases, the answer is nothing at all. This is why high triglycerides are often called a silent condition. A person can be walking around with dangerously high levels and feel perfectly fine, completely unaware of the risk building up inside their arteries. However, when triglyceride levels exceed about 1,000 milligrams per deciliter, patients may start to experience noticeable symptoms. One of the most serious complications is acute pancreatitis. Extremely high triglycerides can trigger inflammation in the pancreas. This becomes a medical emergency, requiring immediate hospitalization. Doctors might also notice physical signs during an exam. One classic sign, eruptive xanthomas. These bumps are tiny deposits of fat in the skin, appearing on the buttocks, shoulders, and backs of arms and legs. Another sign, lipemia retinalis on eye exam. The retinal blood vessels can look pale or milky white instead of red. So you have a milky blood sample and lab results showing critically high triglycerides. What do we do now? The first step is always to address the immediate risk. This often requires aggressive, immediate intervention. For doctors, this may mean admitting the patient to the hospital for intravenous fluids and medications to rapidly lower triglyceride levels. Once the immediate crisis is managed, the focus shifts to long-term control and prevention. The doctor will prescribe the right medications such as fibrates or high-dose omega-3 fatty acids, which are very effective at lowering triglycerides. For the patient, this diagnosis is a call to action to make significant lifestyle changes. Diet is the cornerstone of managing high triglycerides. This means strictly limiting sugar, white bread, pasta, and avoiding unhealthy fats. Instead, focus on a diet rich in fiber, lean proteins, and healthy fats like those found in fish, avocados, and nuts. Regular physical activity helps the body use triglycerides for energy and improves overall metabolic health. Regular follow-up appointments and repeat blood tests are essential to monitor progress. By taking these practical steps, we can turn that shocking strawberry milkshake sample into a story of recovery and a return to long-term health and well-being. It requires a team effort, but the results can be life-changing.